Hello and welcome to Health in Capsule. Pregnancy is a very stressful situation for many women. Couple this with an ongoing pandemic in the background, and the number of women who are very much stressed are increased. So, in this talk, we are going to address this very issue, that is, mental health issues in pregnant women during a pandemic. Bringing this to you is Professor Sundari, who is a very well known obstetrician and gynecologist of Bengaluru. Her gentle voice, her gentle tone, and the amount of information and suggestions that she has packed into the short lecture is bound to help many women.
Mental health problems in pregnant women during the COVID-19 pandemic has emerged as a major public health challenge requiring appropriate and timely health support to these childbearing women to avoid major adverse health outcomes. I am Dr. Sundari, a retired professor from Ramaya Medical College. I like to talk about pregnancy, mental health during a COVID 19 pandemic. I would like to discuss this under three headings. Why the mental stress is increased for pregnant women during this COVID pandemic, and what is its deleterious effects on pregnancy and the unborn child. How do we diagnose a woman having a mental stress? Can we prevent this? And what are the medications are the treatment available to reduce this mental stress or cure this if it has gone to depression state. COVID strategies are creating a lot of psychological stress on this pregnant woman. Social distancing has resulted in lack of social support for this woman. Usually pregnant women are visited by her kith and kin, or she would go to her parents whenever she feels like. All this is curtailed because of the social distancing. Now, she herself has hesitation and fear to go to the hospitals to visit her doctors because of the fear of contracting COVID infection. Even healthcare facilities are not as easily available as it used to be in non-COVID times to her. Her visits to the obstetrician are restricted to at least 3 to 4 visits in the whole tenure of 9 months of pregnancy. As against, it used to be every month or once in 15 days, even in once in a week at the last trimester of pregnancy. This would give her a lot of moral support and clear all her doubts. Even now, during the visit, the time spent with each patient has been minimized, and in the bargain, the pregnant woman is left with a lot of unanswered questions and a lot of anxiety in her. Now, what is the effect of this on her pregnancy and on herself? Yes, if this stress continues, there is every chance that this pregnant woman may go into anxiety and depressive psychosis. This stress releases a lot of stress hormones in the body, which have deleterious effects on various organs in the body. Pregnant women can get high blood pressure during pregnancy. She can go for preterm labor, and the baby cannot grow properly. That's we call it as a fetal growth restriction, and very rarely she may lose the baby also. If she continues to have mental stress in a postpartum period, there is high chance that she can land up in postpartum psychosis, which again has a lot of deleterious effects on her health and the newborn's health. Now, what are the effects on the newborn? It is said that even the newborn babies have got ill effects. There's a developmental defects. The overweight and obesity can happen. These children may develop symptoms like autism symptoms, and the neurological and cognitive developments are suboptimal in these children. Now, how do we diagnose that a lady is under mental stress or she has got a mental ill health? Now, there are few symptoms. If one of the symptoms, if she has, she herself can diagnose that she is under mental stress. Now, any of these following symptoms, if she has, she should think that she has got mental stress and she has to seek medical advice. The sleeplessness, she is not able to sleep properly in the night, and the change in the eating habits, that is, either she eats too much or she refuses to eat. She is not able to concentrate on anything and she cannot enjoy any of the events in her life. This will bring us to say that the lady is under mental stress. Now, how do we prevent it? I think a small things in life can prevent a mental stress in pregnant women. First and foremost is she has to think that she is all right. She has got a lot of help when she needs. Always she must say that all is well. Now, the other thing which is most important is she must avoid seeing or listening to the COVID news either in the TV or in the radio or reading in the newspaper. This causes a lot of stress. Instead, she can watch good programs in the TV like movies or some dramas or dance programs and music programs, which will really give her a little mental pleasure and peace. Now she must cultivate to read good books and listen to some sort of discourses which will again improve her mental stamina. Now she must indulge herself in regular activities. Maybe a little change in lifestyle like practicing meditation and pranayam will definitely help to calm down her mind. In spite of all these things, if she is not able to cope up with the stress, it is advisable that she will seek medical aid. Her obstetrician can help her to put her to a counselor who really helps her to come out of this mental stress. If it is not possible, maybe she needs a little more medical help, that is, taking some medicines to come out of this mental stress. So, probably we have to avoid getting into mental stress. Please, all the pregnant women, think that you are safe and you have medical facilities whenever you need it. Be assured of it and be calm, be quiet and calm and stay happy and healthy. Thank you for your patient listening.